Hello, everyone. I'm Commissioner Jeffrey Starks, an FCC Commissioner. Thank you so much for joining us this afternoon. At the very start of today's event, an HBCU President's Roundtable, I want to note that this event is going to be recorded. And so, again, deeply appreciate you joining me for my second HBCU President's Roundtable. I truly look forward to that day when we gather again for an in-person session and are able, of course, to do so safely. And who knows, maybe we'll be able to meet up during one of those homecoming seasons one of these days. And so I do believe that it is incredibly important for us to revisit this conversation that we had last year about the intersection of the digital divide and HBCUs, so that we can understand the work that has been done, what remains, and the cross-collaboration on what we can all do to keep pushing forward, even in the face of headwinds. I appreciate you all taking the time to participate in this panel, most of all in our discussion here today. As many of you know, I similarly and recently reconvened a group to continue the dialogue about the future of work and how we are going to reskill and upskill our Black and Latinx workforce that has been disproportionately impacted by the pandemic, along with how we are going to rebuild our vital and small Black-owned businesses. Which brings us to today. HBCUs have rightfully been a spotlight over the last several months, but we all know that HBCUs have truly presided as cornerstones of Black communities across this nation for generations. Our community has always treasured these precious institutions because they produce our most innovative, entrepreneurial, and socially conscious leaders. When you all leave the hallowed halls of these institutions as alumni, as faculty, as staff, or even as a visitor, you leave feeling that sense of pride that we know, because you are reminded of how Black communities press on in spite of any barriers. And so over the course of this pandemic, it has been evident that systemic inequities in healthcare, in education, and in employment persist. And it is HBCU students, faculty, alumni who continue to push for political, social, and economic justice. But in order for these institutions to continue to produce our next generations of leaders, especially during a time where distance learning is widespread, we must ensure that these students have affordable, reliable access to broadband, whether they are sheltering in place in their hometowns in Albany, Georgia, or in Memphis, Tennessee. There is too much at stake. HBCUs graduate about 20% of all Black undergraduates. Additionally, over half of HBCU students are first-generation college students, and 75% of them are eligible for Pell Grants. Pell Grants, of course, and those that are Pell Grant recipients are automatically eligible for the FCC's new emergency broadband benefit, which will provide them with affordable connected devices and broadband networks that we know they need in order to complete their studies. These statistics show us that we must make the crucial investments to connect HBCU students and more broadly to the communities that they come from and the areas surrounding these institutions. The time to make these investments has never been more urgent. Just within the last week, 17 senators sent a letter to Senate leadership, encouraging them, prodding them to craft a recovery package with additional emergency funds for HBCUs, tribal colleges and universities, and other MSIs to support them through this historic crisis that continues to disproportionately impact people of color. And to close, at the FCC, I've made an investment of my own through the recent launch of the Early Career Staff Diversity Initiative, which is a brand new program that will lead to paid internship opportunities and increased recruitment of students and recent graduates, including specifically from HBCUs, and to ensure more representation from employees from underrepresented backgrounds to work at the FCC. The telecommunications and technology spaces in this country must better reflect the diversity of our nation, which is something that I know our guests here today know well about, since 25% of Black graduates with STEM degrees come from HBCUs. Success in these powerhouse sectors of our economy will change the social and economic fabric of Black and other marginalized communities across America. And so it is past time that we have an equitable and connected country. But where there are gaps, we're going to need to be dependent on the folks listening in here today, participating here today, to make those investments in our HBCU students, bolster these anchor institutions, and guide Black STEM professionals over the course of their careers. And so here today with me is to discuss these pressing issues are the very change agents we've been talking about from across the country. We have a returning participant from my first roundtable discussion, Dr. Wayne Frederick, who is the president of Howard University. Thank you, President, for joining us again. I'm also pleased to welcome Dr. Tony Allen, president of Delaware State University, Dr. Glenda Glover, president of Tennessee State University, and Dr. David Thomas, a native of my hometown of Kansas City, who is the president of Morehouse College. The moderator for this discussion, as many of you know, is Dr. Harrison, who received her PhD from Howard University. I, of course, to turn to the personal for just a moment, have two Howard graduates who work with me in my office. And so they always make it a hard point to make sure to remind me when there are other Howard alums in the room. Dr. Harrison is the Director of Technology Policy at the Joint Center for Political and Economic Studies, a powerhouse institution for real. She leads the Joint Center's work on key tech policy issues affecting Black communities, including those related to data, privacy, access to and adoption of broadband, advertising targeting, and artificial intelligence. Thank you again all for joining us here today. Dr. Harrison, the floor is yours.
Thank you so much for the introduction, Commissioner Starks, and thank you to my colleague and friend, Dr. Lisa Valentine, for the opportunity to moderate this discussion. I'm very excited to be a part of this urgent and timely conversation. Like Commissioner Starks said, I am a HBCU graduate, PhD from Howard University. I'm also a Pell Grant recipient, and I didn't grow up with a computer or internet in my home, so I had to rely on going to the library or internet cafe at that point, or my school to do my homework assignment. So this conversation is especially personal and important to me. So we're here to discuss what solutions be implemented to ensure that students, faculty, staff, and surrounding communities of HBCUs get connected to affordable, reliable, high-speed broadband during the ongoing pandemic. We know the pandemic is disproportionately impacting Black communities. We've seen the data and the reports on disparities in health, education, and employment. The pandemic has also exacerbated the digital divide as work and schools have gone largely virtual. According to Pew Research, in 2019, only 66% of Black households in the United States had broadband internet, compared to 79% of white households. And for many students attending HBCUs, the lack of access to reliable internet meant remote learning was simply not an option. Even worse, without a campus, some students have nowhere to go. We're almost 1 year into the COVID-19 pandemic, and access to affordable, reliable broadband continues to be an urgent need for Black communities. And so I want to open it up to my panelists to answer some questions to help us think through the challenges and opportunities. How has your institution handled the transition to distance learning, and how has access to or lack of access to broadband impacted students who are at home, especially those who live in only mobile-only households due to affordability reasons or may lack a home broadband connection because they live in a rural area? And I'll open it up to whoever wants to answer.
So I'll start. At Morehouse, when we evacuated our campus and went with 10 days to distance learning, we discovered that many of our students, in ways that we had not anticipated, didn't have digital access. You know, we're in Atlanta, but many of our students actually come from rural communities, in particular here in the South, and they didn't have broadband access. We also discovered that many of our students were in households where there was only one computer in the entire household. And all of a sudden, our students and their siblings and their parents were working remotely. So we had to partner with some technology companies to supply our students with connectivity, including sending out hotspots, as well as devices. And just this year, because we started fully remote in the fall, we partnered with Microsoft to give every one of our entering freshmen a Surface 2-in-1 computer, and any that needed it, a hotspot. So it really brought home to us, you know, the way in which the digital divide was real, and that many of our students didn't understand what it meant to actually engage in digital education. By that, I mean, many of them left thinking that they could do distance learning on their cell phone. And, you know, basically would write us asking for help because they were just mentally fatigued. You can't do distance learning on a cell phone, even though you're connected to the internet. And it's really brought home the need to double down as a nation on the double divide or the digital divide, and making sure that all communities are connected, because what we've also learned is that distance learning enabled by technology, even when we come out of COVID, we have changed the paradigm for how education will be delivered, which makes it all the more critical.
Dr. Harrison, I'm happy to jump in here because Dr. Thomas has raised some very important points, and we have a very similar experience. We actually kept about 200 of our students on campus at the start of the pandemic. Think of those students, about half of them is otherwise homeless without Delaware State University, and the rest from some very vulnerable populations. What I can say is that we were fortunate to have engaged in a relationship with Apple in 2018, where we were already giving our incoming freshmen either iPads or MacBook Pros based on their disciplines, and also did that for the faculty as well, with the idea that we would go digital by 2020. But I don't want to fool anybody here. The take rate was slow, particularly among the faculty. It was really an opportunity for us to accelerate a lot of that, all those resources. And what has happened has been fairly amazing, because to Dr. Thomas's point, you have seen students go back to their situations in their respective homes with limited capacity to technology in some real ways, and that has been substantive for their learning. Our decision was to try to bring back as many students as possible for that very reason. And as you know, that takes a lot of testing protocols, which also meant that we needed to expend some funds, but we were able to develop a relationship with a place called Testing for America that not only developed our testing protocol, but raised the funds to support it. I'm proud to say that we have administered about 37,000 tests for students, staff, and faculty with about 0.5% positivity rate. But the learning itself has still been a challenge. We've been able to get them into the right environment, but being able to make sure that they not only have the tools, but are using those tools successfully and are engaging with the faculty in the right way is a constant challenge for us. And while we've made good progress, there are quite a ways to go. So we've learned a lot in this process, like many of my colleagues, I'm sure. But what I can say is the HBCU philosophy was really what mattered here, that our students come to our institutions for different reasons than just the quality college experience. They're trying to change the economic trajectory for themselves, their families, and their community. So it's important that we wrap our arms around them even more closely now.
I want to follow up also and agree with both of my colleagues. That is, our students, the population that we serve, were not prepared for this crisis, and we had to get assistance from alumni, from others, from the CARES Act, from from reserve funds, we managed to get, because they didn't have the devices. That was the big problem was getting devices to the students, because as Dr. Thomas said, they can't do it on a cell phone. But what we were prepared for, what was quite different, was that the population we served, many of them, and it was just bigger than accommodating remote learning, that many of our students don't live at home with their parents. They take care of their parents. They're heads of households while attending school. And they have to do their study assignments, yes. In addition to that, in a larger picture, they had to help their family with access to internet services for applying for SNAP benefits and medical benefits. And so it's bigger than remote control, remote learning, even though distance learning was our highest priority. But because of our population that many of us serve, being the type of student we now have evolved into, because that day is over when a parent drops a student off, come 4 years, you drop them off for school, then they come back and get them, 4 years they graduate. It's a new day. We have the special populations, the adult learners, the students who take care of themselves and have to have all kinds of, they need the broadband for all kinds of services in addition to their learning that they must do on campus. And that was an eye opener. We knew about the getting on board in one weekend and getting all that done, but we were not prepared for the students who needed the other services to take care of their families, their parents, and their little sisters and brothers and the others in their household.
Dr. Frederick, would you like to tell us how you all were handling this situation with Howard University?
Well, sure. I think you heard a lot of similar things that we did from the previous speakers. I think in addition, Howard has a hospital, and so we had a unique challenge there. You have a health sciences complex and students who still needed to get an education. And it reminded me of, when I was in medical school, 1990 to 94, around the AIDS epidemic, and we were trying to understand, what to do. And I remember even the testing, we went from getting a, HIV test if we were suspicious, to getting a consent for an HIV test, to getting a CD4 count in lieu of an HIV test. I mean, it was very complicated then, and it was a bit of reliving that. And so we were concerned about getting those students in particular exposed to what would be an unusual circumstance, and if anything, a once in a lifetime circumstance, but would really equip them with a different type of skill set. And so that proved to be a different challenge, because we want to keep them safe, but at the same time, we didn't want to deny them that opportunity. So we made adjustments to do that. The students, complied with what we expected, and they really self-monitored, which is the other thing that I want to point out. We had 2 students stationed at the entrance to the hospital every day, and they checked their own colleagues in. They checked their temperatures. They went over the questionnaires with them until we got our Bison Safe app up, and it was a wonderful thing to see, that they were so committed to making sure that their academic experience would continue. And I think that that's really part of the beauty of what we do as HBCUs as well.
Thank you so much. I mean, I think what you all have done is provide a great, picture for us to understand the specific and unique challenges that students who attend HBCUs experience, right? The social, political, economic factors that are happening in their lives, and how not only the hotspot being important, but the device is important, right? And also the speed in terms of being able to watch your classes online and download videos. So thank you for setting the stage. I want to turn it to Commissioner Starks. You mentioned the FCC's Emergency Broadband Benefit Program during your opening remarks. And can you tell us a little bit more about this program and how you believe it can help HBCU students get connected?
I think I would know how to unmute by now. And so great question, Dr. Harrison, and to kind of, weave in what obviously a number of the presidents have already spoken about. Late last year, Congress passed an omnibus appropriations emergency COVID relief legislation, which ultimately provided this $3.2 billion emergency broadband benefit. And so the real goal is something that I've been talking about for a really long time, which is to make sure that we connect low-income households to broadband at affordable rates. You have millions of households right now that are making, the difficult decisions. You heard, President Glover talk about it, how in many ways these are presidents, these are folks that are the heads of their household. I think that is apt. And so you're talking about the need for broadband covers education, as we're talking about here today, but it also covers folks that need to apply for employment, trying to find how to get reconnected to a job, need to apply for unemployment assistance. You're talking about telemedicine, as you heard Dr. Frederick talk about, and the real need to make sure that we keep both patients safe as well as keep our medical workers safe. And then obviously, as Dr. Thomas, mentioned, you can't do all this on a cell phone. You do need that critical home broadband connection in a lot of ways. And so this low income program, I think, is going to be the best opportunity for us to crack the digital divide, both for low income households, which also disproportionately are communities of color. And so ultimately the program, just to break it down really quickly, is broadband providers will be reimbursed up to $50 each month for a low income household that they serve. The provider can also be reimbursed for up to $100 for providing the household with a connected device. And so the eligibility criteria has been expanded even beyond the Lifeline program for those that are aware of the FCC's Lifeline program. But most importantly for today, it includes, like I mentioned in my opening remarks, those who have received a federal Pell Grant. And so, if you are a Pell Grant recipient, you are automatically going to be qualified for this emergency broadband benefit that is going to get you connected to a high-speed broadband connection as well as a device should you need it. And so, to wrap up, if we're successful, which we have to be, this emergency broadband benefit will reach more low-income people, more households of color than any previous FCC effort to close the digital divide. And so I am all in for that. And we need to make sure, much like this event here today, and working with presidents of the so many of the HBCUs are deeply impactful to students, for communities, for a whole host of reasons. And so getting the word out, making sure that you all know about it, that HBCUs more holistically know about it. And then, of course, obviously working with, as you've heard a number of folks talk about, working as well with some of the folks in industry who are going to be able to make sure that we have a lot of robust participants. And so connecting our HBCU students to broadband in this pandemic is absolutely critical. That's why we're all here today. But we also must remember to take a step back, that our nation is dependent in a lot of ways on broadband as well. And so we are all going to need to push in the same direction here.
Thank you so much, Commissioner Starks. HBCUs are going to greatly be impacted by the program, and I think that's important for different stakeholders to be working together to make sure that it makes the most impact in communities of color. HBCUs not only serve students, but they serve the surrounding communities, right? They're anchors of change in often historically Black neighborhoods. So I'd love to hear from the presidents, how can increased and upgraded broadband infrastructure on your campus and in the surrounding neighborhoods better help those communities?
Yeah, I'll be happy to start. I think it's actually could be very critical. One of the things that we had started right before the pandemic was having our nutritional science students shop with the residents of Ward 7 and 8. And while we all know there's a food desert there, 170,000 people with only 2 full-service groceries, my initial idea when I floated this to the dean was to go to really the grocery stores. And what they expanded the program and did was they went to the corner stores. And so you look at something like that, if you can have access where, especially in a pandemic where you want to keep socially distanced, et cetera, you can meet the community where they are, but still have the students have the opportunity to engage, and using an app where you can also not only provide advice, but you can get information back about what people were able to purchase and go. So there's a lot of opportunity, in my opinion, to close the divide around healthcare disparities in particular. And the second one I would mention is the use of artificial intelligence. We're looking very strongly at adding that to our curriculum, because the ability to predict who can get what interventions on a preventative, in a preventive circumstance would be important. And again, you need trusted messengers, though. I know as we talk about technology, we have to recognize that the more information and data that we want from our community, they are not going to want to give that up unless they feel they're trusted messengers that are collecting that data. And that's another reason why I think HBCUs are well poised to really not only just close the digital divide through some of the access points, but also be the trusted messengers to really allow our community to get confidence that what they're sharing will be protected and taken with the kind of sacred nature that it needs to be.
And I'll follow up with that one too. I think, in addition to what President Frederick is saying, I think we agree that the broadband infrastructure is a high priority in minority communities. It needs to be elevated to the level of a basic necessity that's as critical as power, water, electricity, gas. It's in the life of a student, the life of the community. It has to be elevated to that level. We see, even with the Dallas situation in Dallas and other places, we see how critical it is now to have that broadband connectivity, because without it, there's, yes, we need it for studying. Yes, we need it for students, because students are the community too. It's no longer a necessity. It's no longer a luxury. It is absolute necessity now. And so it has to be elevated to that level for all this to make sense. It is needed just as we need electricity and we need water to live. We need the broadband services to make sure the minority community is covered with broadband access. It's a reality of the students of the community we serve.
I just want to follow up quickly on Dr. Frederick's point about the messengers. I do think that's critically important. And in Delaware, you'll see that our faculty, staff, and students are quite active in the local community. We have actually a Center for Neighborhood Revitalization Research, which is around doing what we call people-intensive research, really trying to bring those folks we're looking to find out about their needs into the process and create a real learning environment between the two. And I think that has engendered a certain amount of trust. We just established a diagnostic testing facility just in December. And we did it because of the concerns around access for communities of color in our own Delaware State University community. And I can tell you that that is suggesting that we are doing something specific for those who in some ways need it most with respect to testing. I think you could logically extend that to vaccinations as well, where we hope to be a leader in that area as well. So being able to not only educate great Black leaders, as we've done historically, but also bring our intellectual capital to the communities that we all call home in some way, I think are very, very important to how we move forward. And I think FCC can be a big part of that.
Thank you. I think it's really great to hear how engaged, despite this pandemic, students have been in terms of helping the community and trying to foster ways to ensure that people had the resources they needed. It relates to the kind of unique experience of attending an HBCU in that there's a socialization aspect and the ability to connect with classmates and mentors, or to even organize for social change. And so I would just want to hear from you all how you believe broadband connectivity has helped students maintain some of those experiences despite what's going on.
I feel like we're preaching to the choir on some level. I mean, I would say one pandemic exposed another. We all know that the concerns around law enforcement interaction in communities of color have been longstanding. The difference this time is everybody was home watching their TV and couldn't turn away. And I do think that raised the level of import in the broader community. Having said that, I can tell you that my students, most of which were away from Delaware State at the time, were demanding that Delaware State step up and look at itself too. So I needed to come to a couple of rallies, which I did. I needed to make sure that our vendors were reflecting the kind of racial equity and equality that we believe. And these were things coming from the students themselves, and they were organizing certainly on social, but it was to, in effect, meet somewhere, do something, engage in some way. And that has been actually very heartening, particularly as they came back to campus and actually extended what they were doing in their local communities right on campus. So one of the most heartening things that happened last fall was they said, Dr. Allen, we need to have better relationships with the university law enforcement, not because there was anything happening between them, but it would set the example for what folks should expect when they return home. That has really developed into an ongoing relationship. It's really virtual in nature. Lots of those interactions are happening in the virtual fashion, and I think it's making a big difference over time. So I can't say enough of that importance. It is meant to continue those civil rights and social equity traditions.
And thank you. And it's also allowed we saw the young people use social media to organize themselves. You know, the social justice issues that Dr. Allen mentioned, just the Black Lives Matter movement. They're using for organization purpose. And then they use it to just communicate more, to lift each other up. And look at the GOTV, the social media. That GOTV effort through this broadband, I mean, we saw an outstanding voter turnout that led to historical outcomes. The first Black woman vice president. We saw so many historical outcomes based on the fact that the broadband has helped the students to connect. You know, then we have the new innovation. I think the students will going to benefit so much more from new innovation. You know, the esports, the gamification, the artificial intelligence, the mixed reality, including both virtual reality and augmented reality. And then the internet too, you know, where they have dedicated lines just for research. So there's so many possibilities for the students that will help the students on campus as well as the community that we serve.
Thank you. Thank you for providing that picture. I want to switch it up a little, and I want to talk about, you know, some of the things that we've been experiencing with regards to health. And Dr. Frederick, you mentioned some things a little earlier with regards to how medical students have had to step up, or the different challenges that they've gone through. I wanted to know if you could tell us a little bit more about how the pandemic has helped medical students at Howard learn more about telehealth and how it can help improve quality of care for patients.
Yeah, no, certainly they've learned a lot about telehealth, as has all the faculty. We have spent, you know, quite a bit of time engaging and interacting with patients through telehealth. Having said that, one of the things, obviously, that's a barrier to that, again, is access in the neighborhood. So, you know, at the university, we have that, but getting people access. So looking at innovative ways of how you do that, you know, using community spaces and churches where citizens can go and access a device so that they can make their appointments, those types of things. Right now, we're seeing the same difficulty with even vaccinations, where everybody doesn't have an email. So we are also encouraging people to come to the university to help. So the students also, I think, have seen that we could be effective in reaching people, but also they've also seen the limitations within their community, and that's key. You know, I just wrote a op-ed that will be published in the New York Times about this, the crisis to follow the pandemic. Screenings for some cancers are down as much as 89%. And the argument that I am making is that unless we start taking our healthcare system out into those communities, so equipping them with technology, but also recognizing some of the limitations, we're going to get into some serious trouble in our own community. And so while COVID-19 has already disproportionately impacted chronic illnesses like diabetes and hypertension that have gone untreated during this time are going to be worse. And so the students see that, and you can't screen somebody for colon cancer via telehealth. So those limitations are limitations we have to recognize, but we also have to encourage our students to think of other things that they can do. Can we give patients video pills at home, and that way screen them for colon cancer as an example? And I think it's our students who are going to be the ones that are going to have to lead that, because the market for that are patients who can't necessarily access, you know, facilities like a medical center.
Thank you. And, you know, a follow-up to that, Dr. Thomas, you all work closely with the Morehouse School of Medicine. And I want to be clear to folks listening in today that Morehouse School of Medicine is not a part of Morehouse College, but you all work closely together can you tell us what role Morehouse School of Medicine has played in your response to the pandemic? That's for Dr. Thomas. We're actually getting some feedback issues, or is it just me?
Can you hear me? We've got some.
Okay, we'll hold on. I'll go back to Dr. Frederick, just because you are the MD on the call. So on a similar note to what you have mentioned, just want to hear a little bit about how are physicians responding to telehealth services and the importance of deploying those kinds of services in communities of color. You mentioned some kind of unique things that you all have developed. So we'd like to hear a little bit more about those.
Yeah, I think it has been a very big transition. I know even earlier when we were talking about teaching, when I had to also get certified for online teaching. I teach a course every spring on the presidency to doctoral students. And I also teach the medical students, the sophomore medical students. And having to do that online, it's different. So the other thing that we had to learn as well, the faculty and the physicians also don't all have devices as well. We make some assumptions as well about that. And so we also had to equip them with the tools and the training as well to do it. Because I think the other thing that's important is that you have to be trained to do these things as well. It's not the same thing like being in the classroom or being in front of the patient in a room. And so I think that has also been a learning curve that, folks are getting up to speed with. And then I'll say the last part of that, which I think several of my colleagues have mentioned, lots of the philanthropic community have stepped up to try to supply devices and supply broadband. I think the FCC's lead on this has to be commended, because that digital divide is one that really, if you can close it, you can really close lots of disparities, income inequality, the healthcare disparities, as we mentioned, but there's so much more, educational disparities, et cetera. I mean, even if you look at childcare and the difficulty around that has been posed in terms of K through 12, and that has certainly affected our faculty and physicians as well. Because being at home and having a child on being educated remotely, you have to devote your time to making sure that they're getting the right education while you're trying to do your job. And I think all of that has been a challenge.
Thank you. That relates to many of the topics you all have been talking about in terms of technologies and the new ways in which they will be impacting jobs in our communities. Commissioner Stark speaks about the intersection of the future of work and broadband access, particularly as it relates to how we can best support Black workers during this moment of increased technological change. And so all your institutions have produced Black alumni who work in the STEM space. Can you tell us a bit about the work your institutions are doing to ensure that Black students and alumni have a seat at the table, particularly as it relates to the Technology Center? And I'll turn it over to President Allen.
Thank you, Dr. Harrison. I would say, and I think Dr. Frederick alluded to it, not surprisingly, in moments like these, particularly around income inequality and racial equity, the corporate community steps up a bit. And I think in this instance is more sustained than it has been in the past. And I've said to my colleagues that it's our moment to take full advantage of that. So we have spent a lot of time just rethinking our career pathways programming. You know that as career services, I'm sure. But what I've told a lot of the corporations we're speaking to is you need to start with us much earlier than their rising junior or rising senior year. And it needs to be a bit more of a continuum of networking opportunities. In many ways, we talk about our first generation college students. I was certainly one of those, but well, many of them are also first generation corporate. So there is a landscape that you have to navigate and learn while trying to be your authentic self. The good news is that folks are coming now, not just with dollars and support, but commitment with respect to actual jobs. We just started a program with a couple of finance organizations, Bank of America and JP Morgan Chase in particular, that are dedicating a number of jobs for our graduates who go through that program. The other thing I'd say is the alumni, we don't mention them as much as we should, but in Del State's case, they've stepped up too in the virtual format. They've developed something called Dsu Connect that is connecting alum in a wide variety of disciplines with current students virtually. First time it's ever happened. It's building capacity in ways that I don't think either side really ever thought before the pandemic. But that's a way to not only just get in and get an interview, but to sit down and talk to somebody who's been where you have been, wants to understand the path that you're trying to go in, and can open a door in a different way than you might get from the traditional kind of career pathways platform. So I do think this is a unique opportunity for us. It is important, though, for us to make sure that we are collectively maintaining that momentum. I think Commissioner Starks mentioned it at the start. What I think is clear now than ever before is that the institutions that are HBCUs are some of the most important institutions because we punch significantly above our weight. 3% of all colleges and universities still graduating 25% of all Black graduates, and 50% of all Black graduates today started at an HBCU. So really understanding the power that we are effectively a first choice employer. I mean, first choice for employers, particularly those who believe in a diverse talent pipeline, is something we really do have to take full advantage. And we're trying to do that, I'd say, across Delaware State and certainly my sister institutions as well.
Thank you. I know we have a little bit of time left, but I wanted to get in an urgent and an important question. And I'll ask my panelists to have some very short responses. But what does a connected, equitable future look like from your perspective as HBCU presidents? And what support do you need from the FCC or Congress to ensure that we meet that goal?
I'll try to be quick this time. I would just say this, to be a 21st century university, a great university, we have to be contemporary. And I think the FCC and Congress can help in making sure that we're contemporary. I think you all know that we face serious, significant, sustained infrastructure problems, both as it relates to our capital needs and our information technology needs. So investing deeply in these institutions along those scores, I think will have significant effect over time.
I think the FCC can assist us. First of all, we have to make sure that every community has access. That's a given. And in African American communities, we have to make sure we conduct business more online. And this is so different. Even we've seen a year ago how much we've changed and depend on broadband so much more. I can tell you a first example. I recently had just an online doctor address a medical issue. During this 1 hour period, I shopped in a department store, I ordered groceries online, had a medical telehealth, all in less than an hour. I never left my home. So companies are looking at this now, but we're never going back to where we were. So the FCC can help us to make sure everybody's connected, or we can make sure we have the quality of security that will protect the hackers and the other issues, the identity theft, and the firewalls need to be bolstered. So we want to raise the people's confidence that this is a teachable moment, and webinars like these for our community, so the students can help and get credit for it. So we just have to make sure that since COVID has shut down and eliminated how we once worked, and we once operated in those face-to-face services, some of them are gone forever. So if you could help us to educate the communities and the public, I think that will serve a greater good for us.
You want to get a word?
I was giving Dr. Thomas an opportunity to jump back in since he's here. I think you're on mute, David. You're on mute.
that technology.
All right, well, while we get him sorted, I think again, comments that have been made, I think those are important. The one thing though that I would put on the table as well is education. We have a middle school on our campus, and we give those students each a device. And just as Commissioner Sachs was saying that, in his opening remarks, that's the first device in some of those households. And one of the things we spend a lot of time doing is educating the parents and the students about how to use the device, how to surf the net, some of the things that I don't think we pay as much attention to. And I think the recent attack and the cybersecurity issues that our nation has been subject to disproportionately, again, those in minority communities are actually at larger risk because they're less likely to have the types of protections as our institutions are as well. And within an institution, like Howard's, with the complexity of all of the things that we have, including a radio station, a TV station, and a hospital, those risks are escalated because you have medical records that you have to protect, et cetera. And so, as was mentioned before, having the right types of infrastructure, the education around what's needed to keep your personal data as well secured and what's responsible usage, I think is just as useful in our communities. And again, the FCC, by putting this together, and Commissioner Starks, I have to continue to commend you. This is what the community needs, because these are the types of things that will educate people about that. So we can give them devices and hotspots, but we also need to make sure that they're educated about how to protect themselves as well.
Well, I'll say here, I know we're getting ready to wrap, and obviously, if President Thomas is able to come back or get back online, I don't know if there's a number we can get him to call in as well. Happy to hear his kind of closing thoughts. I know there's a lot that's on his mind as well. But I deeply appreciate that, President Frederick and President Glover, and of course President Allen as well. For all the deep thoughts and insights. I do think it is incumbent upon me as certainly an FCC commissioner, but upon the commission more broadly. I wrote an op-ed last year in Essence magazine talking about a conceptualization of broadband access as a civil right. And in that way, viewed through the right prism, a civil right is something that enables us to engage our civic duties in a lot of ways. When you're talking about, for instance, the right to vote is also economic power. It also translates into education. It also translates into housing. Similarly so. I know somebody mentioned punching above their weight. I think in a similar way, connecting to broadband punches well above its weight as a civil right. It is economic access and power. It is education, as we've been talking about today. It is telemedicine and healthcare access in a lot of ways. And then something that I have spoken about as a commissioner, and I know I'm sure a lot of our panelists here also agree with, just making those personal connections that are enabled by being online right now are essential for my kids to speak to their grandparents, where everybody has to maintain safety, but also for mental health. And we do know that making sure that we're able to connect with friends and with family, and there are millions of Americans that are struggling with isolation, and how much that, again, is going to impact folks in their mental health as we're all trying to see our way through this pandemic. There are so many ways where the intersectionality of broadband has to be viewed as something that hits so many lanes and so many vectors. And so I think, I don't know if we're planning to take questions or anything like that, but I think we're probably also out of time. And so deeply appreciate the continued partnership, the continued collaboration with each of you as your presidents. Again, would encourage everyone to make crystal clear that your federal Pell Grant students should know, to the degree that they are struggling with their broadband and with their connectivity, that help is on the way. If folks need to get in touch with somebody, they can contact my office. I believe that deeply. We'll make sure somebody gets back to you, but also the commission is going to be doing this work here very shortly. And so, as always, everyone, please be safe, be well, and look forward to the ongoing partnership and, like I said, collaboration.
Thanks for having us, Commissioner.
Yeah, thanks all.
Thank you, Commissioner.